Throughout today's presentation, you'll have an opportunity to hear from myself and a few other of the committee members, each bringing a unique perspective and knowledge to the topic. Just looking, it looks like I have a message. I think it's just because we're recording started. Okay. I don't know, I can't see if there one committee member may be joining a few moments into our today's presentation, but Christina DeRoche will be joining us, who is the director of the Research Center from Canada College. We have Carly Gammon, an Indigenous mental health worker from Basane Aboriginal Mental Health from CMHA Muskoka-Parry Sound, and Lana Wetham, a supervisor from the Early On Child and Family Center for Parry Sound DSAB, all of whom you'll be hearing from a little bit later in our presentation, and all who are valued committee members of our table. A couple little housekeeping items. I'm fairly comfortable with virtual meetings, but a little less familiar with Zoom. So please, I ask for your patience if you happen to have any little technical glitches, although Kathy has been very supportive this morning in getting organized. Feel free to ask any questions throughout our short time together by raising your hand or adding something in the text box. We anticipate to have enough time at the end for a question and answer period. I appreciate everyone's schedules are really busy, so feel free to engage and be involved in whatever makes most sense for you today with your cameras on or off. We'd like to begin with a short poll. We invite you to participate in that as an opportunity to engage with you again in our little time we have together. And just to also mention that as presenters and representatives of our community organizations, we declare that we have no affiliations or financial support to disclose. We'd also like to acknowledge that this presentation is for educational purposes only. The information presented is based on current evidence, local resource mapping, and stakeholder input. We are not medical professionals, so will not be providing any clinical or treatment guidance. The referral pathway and recommendations presented were developed primarily through the Western biomedical lens. As such, they may not fully reflect traditional Indigenous worldviews, healing practices, or culturally grounded approaches to mental wellness. We encourage the integration of Indigenous worldviews and traditional healing within the mental health support. So today's presentation, the purpose is to share this locally tailored perinatal mental health care pathway with the goal of empowering all healthcare providers in the Nipissing-Parry Sound District to effectively and efficiently treat patients experiencing any perinatal mental health issue. Our learning objectives today is to help and encourage people to recognize the impact of timely mental health support in improving outcomes for individuals and their families during pregnancy and postpartum. To understand the structured mental health care pathway that's been designed and tailored for our region. To also share information about community supports that can contribute to enhancing patient well-being, and to finally explore practical applications of the mental health care pathway. It's an ambitious agenda, so we're going to do our best to get through it all. So I think, Lana, if you haven't already, could you put the Mentimeter in the chat? And I'll ask that each of you just complete and click on the live poll. And it's just a way for us to first kind of get to know you and see who's in the room with us today. I'm going to maybe actually then unshare and see if I can have the live results come up. Oops, 1 second. I did say, hopefully I don't have any technical issues, and here we are. Can people see the, I'm going to end slideshow maybe.
Yeah, it's still showing the slideshow, Tracy.
Okay, 1 second here.
It is in the chat though, Tracy, so there you go.
Okay, so I will choose mine because I'm in registered nurse. We'll see if this comes up. Okay, I think because Christina's not here, we're going to have
Christina actually just joined us, so
Okay.
Perfect.
just may be catching up.
All right. Well, maybe what we'll do is, just in light of time, I will ask people just to put their in the chat, maybe put who they are and their designation, and just if you feel comfortable, just as we get to know who's in the room with us today, since we don't have the chance to go through full introductions.
Tracy, I'm
Let's-
here. Can you hear me?
Okay. Yes.
Yeah. Sorry about that.
No,
I was
that's
just literally pulling into my parking spot. So I'm just getting everything set up.
Well, that's okay. Maybe we can come back to it because there was a couple other questions in it, maybe at the end,
Okay,
if it works out.
perfect.
Yeah, sorry about that. So just to get into the topic, I'll move along and then maybe we'll come back and have a chance to engage with you further along in our presentation. So while pregnancy, childbirth, and everyone can see my screen, yes. While pregnancy, childbirth, and parenting are often seen as times of excitement, this period from conception to 1 year postpartum is also associated with increased risk for onset and relapse of mental health conditions. In fact, mood, anxiety, and related disorders are some of the most common conditions that arise in pregnancy and in the year after childbirth. They can affect anyone, including mothers, fathers, birth parents, and partners. Symptoms can be mild, moderate, or severe, and can include depression, anxiety, bipolar disorder, obsessive compulsive disorder, post-traumatic stress disorder, and in rare cases, psychosis. Without treatment, symptoms may last a few weeks, several months, or even years, depending on the severity. Untreated perinatal mental health issues can negatively affect parents, children, and families, impacting attachment, development, and long-term outcomes. This perinatal period is a unique time with so many changes and also a time of rapid growth and development. Hence, is well recognized as a critical period of child development that can predict future health and well-being later in life, thereby addressing the emotional and psychological well-being of individual caregivers during pregnancy and postpartum period is of significance, not just for the individual, but also that of the future health and well-being of the entire family. Research estimates that 1 in 5, so 20%, experience perinatal mood and anxiety disorders, and that many cases can go undetected. Perinatal mental health disorders are among the most common conditions during and after pregnancy. Research is also showing that suicide in the perinatal period is emerging as one of the most common causes of maternal mortality. While perinatal mental health continues to be a growing concern, locally the concern is even greater. For some time now, our region has consistently had significantly higher rates than the rest of the province across these perinatal mental health indicators we have available. As represented on the slide, you can see from the data we have from the Public Health Ontario snapshots from data from the year 2023. Here you'll see how maternal mental health concerns during pregnancy continue to rise locally and are double, 45%, that of the provincial rate at 22%. Also in 2003, where this data is pulled from, shows that more than 1/3 of pregnant individuals, 38.7% living in our health unit region, reported experiencing anxiety during pregnancy, more than double and significantly higher than the Ontario rate of 17.7%. Also, nearly 1/4 of pregnant individuals, 22.9%, in the health unit reported experiencing depression during pregnancy. In 2003, again, more than twice and significantly higher than the Ontario rate at 10%. Nearly 1/10 of individuals who gave birth, 9.3% living in our region, reported a history of postpartum depression after a previous birth, and which is more than double and significantly higher than the Ontario rate. These trends highlight the urgent need for improved mental health support and services during the perinatal period. The good news is that perinatal mental illness is treatable with early identification and interventions, and healthcare providers are very well positioned to identify and respond to the mental health concerns in the perinatal period. And I'll pass it off to Christina just in time. If you just speak a little bit, some of the research that's been done locally.
Thanks, Tracy. So everybody can hear me okay, right, Tracy?
Yes.
Perfect. Good afternoon, everybody. So Tracy and the group that were basically responsible for this presentation and our research, we've been long part of a committee called the Perinatal Mood and Anxiety Disorders Committee, and it's comprised of various individuals who work with mums and dads across our community in both Nipissing and Parry Sound. And so our group at the Canada Research Centre was part of that committee solely to support them in any of the kind of needs or priorities that they were experiencing. And as a result, we conducted some research with the group on their behalf, looking at perinatal mood and anxiety disorders experiences for not only parents, but also providers during the COVID-19 pandemic. And so what we did as a result is we developed a survey for both groups that we then distributed out in a variety of ways through social media, through direct contact. We had a research intern by the name of Shannon, who was lovely, and she came, she went door to door to different physician offices, midwifery practices, to see if they would respond to the survey. Additionally, we provided an incentive for completion of that survey for both parents and providers. And so as a result of that particular endeavor, we did get a good response rate for parents. I would say the response rate for providers was not as we had anticipated, even though multiple attempts were made. However, the results that we did pull, we really heavily draw upon their qualitative kind of experiences and their responses to formulate what we have here displayed for you today. What we did is we created a executive report for the committee, and in that we summarized the results as you see them here. So really, you know, going over all the experiences, the hard data that was collected, what we found was that the 4 areas that really needed some concentration and some work really built around them for this committee was first on education and training, really hence why we're here, but there's a number of other opportunities that we're looking at. And then looking at not only education and training for providers, but for parents themselves within the community, and looking at events and opportunities that we could capitalize on to really provide the training around education and training around symptomology, screening tools, protocols, diagnostic criteria, and service pathways, et cetera. And for parents, it's really about the resources that are available to them in the community. And then we looked at silo reduction. So a number of our parents talked about how providers operate in silos. And so there's not a lot of connection happening between different providers and different services. And so it was really up to them to navigate if and where possible. And so looking at cross-agency organization education to really break down the silos that exist in our communities, and really looking at a seamless flow of service integration, development of a referral pathway, no wrong door approach. We also looked at outward education and events for parents, obviously, parent and family-driven events, including carousels at various locations. And then looking at opportunities for new services to come in, particularly around parents' experiences on things like infant loss or pregnancy loss, and developing new programs and services to address those gaps that were identified, both by providers and parents. And to be more inclusive, more holistic approach, in particular looking at peer-to-peer supports as well. I think that's all I got for you, Tracy.
Yes, excellent. Yeah, so it was really exciting to, during that time as well, to have some local data and to help us inform some decisions for the committee moving forward. If anyone has any further questions about that, I'm sure Christy would be happy to share some more information about the research findings. So let us begin by introducing the care pathway that was created for our district. And the care pathway is meant to support the providers in our region by promoting a more standardized approach to care. It's designed to support healthcare providers in understanding about how to identify those who are pregnant and postpartum who may be experiencing difficulties with their mental health, to assess the severity of the symptoms, determine an appropriate care or treatment that corresponds to their need, and to follow individuals through their care journey to ensure their mental health care needs are met. It's also to promote adopting evidence-based strategies to improve perinatal and child health outcomes. The care pathway follows the 5 A's, which provides a clear method to promote early identification and intervention. The care pathway aligns with the recommendations from the SOGC Clinical Guidelines 454 that was just released last October for identification and treatment of perinatal mood and anxiety disorders. Other evidence-informed practices also involved including using validated mental health screening tools, which are crucial for early detection. The care pathway is also meant to foster community connections and build awareness and access to community resources, encouraging a community collaboration to foster a wraparound approach to supporting expectant to postpartum families, and as mentioned by Christina, looking at reducing those silos. But ultimately, it's meant to support working towards increasing the impact to strengthen the effectiveness of the initiatives that promote early relational health, resilience of our families and our community at large. So just sort of a little bit of background about the development of the local care pathway, these timelines, and it provides a little snapshot of the steps taken by our committee. So several years ago, when the community table, Christina actually brought the table back together during the pandemic, identified that there was a need to identify perinatal mental health issues of individuals in our district, and also the need to look at understanding for providers and the public about existing supports that are available. In 2021, the provincial care pathway was launched. So we requested permission to adapt the care pathway, recognizing how it was created by field experts and had a companion guidance document also to support the care pathway. What our group did as our local Nipissing-Parry Sound providers is we met virtually for our monthly meetings to review and revise the content, basically line by line. Once complete, we underwent a review process of our partner agencies to ensure we didn't miss any community resources or information, and to receive from feedback about use, how to integrate it into practice. Based on the feedback, some edits were made, including launching the webpage, including some accessible screening tools, and the development of a simplified desk reference is also in progress and will be released shortly. So also within this timeline, when in terms of finalizing our content, we were so pleased to see a couple of other key documents released that aligned with our care pathway, including the SOGC guidelines and the first ever CanMat guidelines related to perinatal mental health. And here's just a little visual of some of the key evidence and guiding documents that were used in the development. To the far left, you'll see this is the Provincial Council's care pathway that is the original source that was developed in 2021. And then next to it, you'll see the October 2024 SOGC national guidelines that they created that went along with Canada's first, with these first clinical guidelines related to perinatal mental health. And these guidelines were built and adapted from the Provincial Council one. And then earlier this year, in February 2025, the first ever CanMat 2024 guidelines for perinatal mood and anxiety related disorders and accompanying patient and family guide were released. So all of these guidelines and evidence were used to inform our local care pathway. So here is a quick visual representation of our 2-page document, and it is available on the North Bay Perry Sun District Health Unit's webpage that will provide you with a link further in today's presentation, where you can access it and also print a copy if you wish. And so, as we mentioned, that we adopted it with permission from the Provincial Council for Maternal and Child Health. The care pathway provides a recommended approach for the identification, assessment, and monitoring of mental health issues for pregnant and postpartum people in Nipissing-Parry Sun District. As mentioned earlier, the pathway was modeled after the 5 A's construct, and you can refer to the guidance document for a full list of references. The care pathway is meant to be clinically applied for a wide range of populations. Where appropriate, healthcare providers should consult with specialized organizations dedicated to the support of specific populations when tailoring the care pathway to the person's unique needs. This tool does not replace individualized assessment, and clinical judgment is required to ensure safe, effective, equitable, and inclusive treatment of your patients. We'll now walk you through the components of the care pathway. The pathway includes, like you mentioned, the 5 A's: ask, advise, assess, assist, and arrange. So ask simply is as it sounds, asking about the well-being of a pregnant and postpartum individual at every visit to identify the need for mental health support and treatment. Advise, moving on to advise, is to advise individuals by providing education on perinatal mental health and arrange support to mitigate factors that affect mental health. For instance, strategies to boost practical or emotional support, improving nighttime sleep, incorporating regular meals, physical activity. These factors may improve mental health for those mild or subclinical symptoms, and in conjunction with mental health treatments for those with problems more severe. Finally, as part of the advise step, we would recommend advising all families about programming that are available to all families, such as the early on programming or culturally specific support, such as the Perry Sound Friendship Center and many other family programs that are listed in the care pathway. Moving on to assess. Assess talks about assessing the severity of the mental health concern, and included are some validated tools that are suggested. The ones suggested are the Edinburgh, the PHQ-9, and the GAD-7. There is a scoring guide, which is only simply a guide, and clinical assessment is required. Moving on to assist. Assist refers to recommending or implementing a treatment step, and the details for assisting the treatment steps flips over to the second side of the care pathway, where more specific details about local resources are found. And then finally, arrange. So arrange follow-ups to monitor recommended treatment plans. This is so important in terms of having ongoing observation and clinical judgment to ensure effective treatment and support has been provided. So we're hoping to give you a little bit of a live tour of each of the treatment steps and featuring some of the local supports in the Perry Sound region. So we're first going to start with treatment step 1. So this treatment step refers to recommending or implementing, sorry, I'm just looking at the wrong piece there. Sorry, it provides a stepped care management plan and may include a range of treatment options and interventions, and it is adaptable to the patient's changing needs and preferences. So just saying, there is the stepped approach, and each patient, you'll choose which one is most appropriate. The pregnant and postpartum individual, and looking at the treatment steps on the second page, can enter the care pathway at any step and can move between the steps based on severity of illness and responses to interventions. Each step is accompanied by suggested interventions that should be administered and recommended to patients. Wherever possible, personal preferences and circumstances of the individual and their family should be considered in terms of making shared decision-making. And as mentioned earlier, ongoing assessment is required. You'll notice that we also have included both public and private fee service options for a full list of options. So as we dig into looking at treatment step 1, Lana Wetham is going to help in terms of featuring one of the local supports. And as shown on the screen, the focus of treatment step 1 is on psychosocial interventions. And this is to help address the common mental health concerns such as depression or anxiety, whether mild or subclinical. The psychosocial interventions listed include some self-help, guided self-help, peer support, and some specific prenatal and family programs. The first step of the pathway may also be appropriate for individuals who acknowledge their need for additional social support rather than clinical interventions. Individuals can benefit at any time during pregnancy or the postpartum period from these interventions, either alone or in combination with other interventions. So now I'll pass it off to Lana to speak more about the early on programming in the Parry Sound District.
Good afternoon. Thank you very much, Tracy. So some of you I already do know, others I do not. I'm just going to give you a bit of an overview of early on if you're not already familiar. It is a child and family center. We have 17 locations in total across the district of Parry Sound, 7 being in the district or in West Parry Sound. Our main site runs out of the Sound Community Hub, which is the old public school on Gibson Street. And we have programming 3 days a week, including Saturdays every other week, so that we can have dads visit us as well, and they seem to really enjoy that. And we also have a mums group. It's called Mums to Mums, and I will share the link to the flyer for that. We have one in Parry Sound, one in Berks Falls, and one in South River. And that group is specific to new moms who have fairly recently had a child. It is closed to the public. We did that very intentionally. We didn't want the childcare provider or the mom that has 7 children and she's got everything down pat and she comes in and her makeup's done and her hair and looks wonderful. We want it to be other moms that are struggling. Some of them come in their pajamas. Some are fully done up. Others are all everything in between. But we really felt strongly that it be a safe place for these moms and their infants. Older children are welcome, and so we do set up the environment to support learning for those older children as well. And we invite our community partners to come in. So we'll have little, discussions or full workshops on child development, sleeping, teething, infant feeding, taking care of themselves. Sometimes we'll have someone come in and do yoga with the mums or meditation, taking care of them. We know that if they can't take care of themselves, it's going to make it harder to take care of the little babies. So they share their stories. There's no judgment at all. And then they're welcome to attend the regular early on program as well. But this is a little closer group, and we also support them with their learning, their comfort level, making sure that their child is developing as they should be. And if not, then we'll have those discussions and either suggest if it's something a little bit out of our realm, they talk to their family physician about, or we will refer them to one of the agencies that do work, whether it's occupational therapy, physiotherapy. Speech and language still is the biggest referral for services in the district of Parry Sound. So that tends to be a busy one for sure, and not enough staff to support. But yeah, we're just wrapping around these moms the best that we can and allowing them to meet other moms so that they can share their experiences and understand that they're not alone and we are here. We're very lucky that we have CAMH support us. And so if we do have some concerns with some moms, we'll get them to come in. and have a relationship, establish a relationship. So if they need to have those deeper discussions, they can. Yeah, so we're doing what we can to support our moms and our dads as well. They don't come to the program, but we've had dads reach out to us for support because they don't understand how best to support their partner. So we'll walk them through that process as well. We also do offer virtual calls with families. Some moms are not comfortable or they don't have transportation and they can't get out to a program. But if they just feel they need to speak to someone, we'll set up a time to meet with them via Teams or just a phone call, or we may drive out to see them and just see how they're doing. So we're really trying hard to wrap around all new moms in the district of Parry Sound.
So wonderful. So Lana, thank you so much for giving a little bit more information about all of the great programming at the Early On Center. And just to clarify, so it's available for all families with newborns up to school entry.
Right.
And I feel like it's just such a wonderful spot for parents to go on. I think just the reminders and hearing from different providers about checking out the center can be helpful. My experience of providing follow-up calls and working with families in the community, it can be really helpful for people to just first go check it out. Often people may think about the Early On Center being for older children, so I think it's really nice then to think about going with their young babies, and it's a great center for children and parents, and a really supportive environment. So I think really wonderful to have that support right in Parry Sound and the outlying areas.
Thanks, Tracy. The
Yeah.
other thing I wanted to mention is that we of course have families that don't feel comfortable walking through those doors. They feel like they could be judged. Sometimes a program can be a little bit cliquey, and so we do our best to purposely break up those areas so you don't have a group of moms sitting on the same carpet every single time. But we are looking at doing more outreach with our families who are at risk. So maybe our families who are attending, living at the women's shelter, our Ontario Works families, our housing clients, our CAMH parents, because we know it's tough to walk in the doors sometimes. So we're trying to support those families as well. And I really do strongly feel that once they come and they establish a relationship with one of the team, that they will return. So yeah, we're doing that too.
Relationship. Yeah, it's
For
wonderful.
sure.
So thank you so much, Lana. So this is just one example of the several resources we have listed under psychosocial interventions, and the others are the other resources that are listed here are all electronic links on the actual care pathway that our group is committed to keeping up to date. And we've already been making lots of little edits already to make sure that it is staying up to date. So moving along, I'll just move on to the treatment step 2, which is psychological interventions and medication. The focus of this intervention is to address common mental health concerns of moderate severity or greater. And one of the interventions here relates to Carly's program. So we're going to pause and you'll get a chance to hear from Carly as she shares a little bit more about the Bassani mental health program.
Sure. Thanks, Tracy. Hi, everyone. Thanks for having me today. I'll try and make this brief. I know that there's lots of information to continue to go through, but I do come from the Bassani Indigenous Mental Health Program, and it's based out of Parry Sound, but we do service all of Parry Sound, East and West, as well as the Muskoka District and the 7 surrounding First Nations communities all the way up the corridor to Doki's First Nation. And our services are for any individual who self-identifies with Indigenous ancestry and or who has Indigenous children or is a partner to someone who identifies as an Indigenous person. And, those are not the only criteria we're looking for. We really are looking for referrals for folks who want to be referred to our program, right? So we, of course, can't assume that because someone identifies as Indigenous, they want to be connected with the Basani program. And we're so grateful to have the broader CMHA agency who also offers support and service. And so we always have choice for folks. And so again, looking for that self-identification in one of those areas. And again, the desire to connect with our program specifically. And then from there, we offer a variety of services, but I'm going to talk just a little bit about the counseling support that we offer today, because I think it's really applicable and relevant here. So we have a few different clinicians who are therapists and counselors in the Basani program, and we offer support to individuals who are seeking some longer-term care and support. So there isn't really a time limit, so to speak, on the support that we're able to offer, which is really a gift, I think, and we're not kind of constrained by those time limits. We are able to work in an ongoing capacity, and we really try to meet folks where they're at. In terms of modalities utilized, we are all kind of trained and have different specialties or different areas of work that we're passionate about and that we have training in. So some of us have done training in the perinatal mood disorder area and are trained in best practices. And so naturally, of course, when we receive referrals for individuals who are coming from that place, we try to connect them with the most appropriate clinician. And then beyond that, we also have our structured psychotherapy counseling program. It's called the Manukmi Indigenous Structured Psychotherapy Program. And it, of course, really is centered around modalities like cognitive behavioral therapy and is really, really a great fit for some folks who prefer a more structured approach to therapy, who like to do homework between sessions. Again, understanding not always an appropriate fit when we have little ones at home, but doing our best to accommodate and be mindful of what that can look like as well. From there, we also, of course, offer, assessment and treatment planning, which includes collaborating and referrals to community partners. We also are able to support and access referrals for psychiatric assessment when that's needed or helpful. And unfortunately, it doesn't tend to happen overnight, as we know, but it is something that we are able to support. And of course, taking into consideration, the severity, the priority of the individual in front of us and trying to make that happen as quickly as possible. From there, we also do group-based counseling as well. The offerings vary, depending on the time of year and what's going on within the agency, but we do have group-based support. And the agency also offers, beyond the Basani Bamadzuan program as well, some specific support for folks in the perinatal kind of stage of life who are struggling with addiction. And so that is for any perinatal person or with any person who has children 6 years of age or younger. And so that is a support that's available, again, based out of both Parry Sound and Muskoka offices. And we do also have an after baby group that is run primarily right now out of Muskoka for various reasons. However, it is accessible to Parry Sound residents in a virtual capacity if that is ever a good fit. And it is something that we hope to expand really soon to the Parry Sound community. Beyond that, we really work from a two-eyed seeing approach. So trying to pair, of course, what we know from Western ways and what we know from the traditional ways and meeting in the middle and really, again, trying to meet folks where they're at and providing that support that is really relational in nature and that is really meaningful to each individual person. Yeah, that's my quick spiel. I hope that helps as a starting place. Happy to answer any questions or stick around later as needed. Thanks.
Thank you so much, Carly. So great to hear a little bit more about all the amazing resources and support that you provide. So as outlined here, you can see how the interventions here include some first line psychological interventions such as CBT and IPT that can be delivered by trained mental health care providers. For more information in terms of treatment, I'd really recommend checking out the new CanMat guidelines that are linked at the end of this document, and then also within the care pathway. I just want to pause, Lana, just before, I know we're almost up at the end of our time. Is there anything in the comment section? I can't quite see if there's anything before I move on to the next section that we want to just pause or acknowledge at this point in the chat.
Oh, we're good.
Okay, all right, great, thank you. And yeah, so just want to move on to then step 3, which includes additional specialized interventions. And this specifically is the focus of this is for mild or moderate mental health concerns that didn't remit with the earlier steps, and or severe mental health concerns. So whether when there's no specialized perinatal mental health care, they recommend referring to your local hospital. And so in Parry Sound, the CMHA is that crisis support and specialization that's available to our district to CMHA. There also is the OTN psychiatrist e-consult, where you can reach a perinatal psychiatrist. Finally, moving on to step 4, this is for urgent care and hospitalization. So this focus of this intervention is suspected mania or psychosis, anyone that's disclosing intention or plan for suicide, self-harm, or harm to fetus or infant. And so, you know, just in terms of looking for crisis services in the Parry Sound District, you have CMHA, and we've also listed in the circumstances where you may need to be looking at child protection, there's a contact information there as well. And so this section provides a little bit more in terms of guidance about dealing with urgent care, but I know with the medical community, they'll be familiar in terms of that pieces. So I really just wanted to highlight each section of the case of the stepped approach. I'm not sure in light of time, I think we want to leave some time for questions if we want to go into the case scenario, or we could just skip over that and just in light of time, but we really just wanted to remind people in terms of looking at an individual like this, looking at the risk factors. We were just wanting to highlight with this case scenario that often, as long as individuals are consenting for the health units to follow up through the Healthy Babies, Healthy Children program, they may get a phone call 48 hours after, and they may or may not accept further follow-up. And then after that point, often they're being followed by primary care. So just looking to be thinking about applying the ask, advise, and assess when working with these families and asking a little bit more questions. So just a little high level overview, asking about their well-being, advising by providing education around the topic, assessing the severity of the mental health concerns, and then assisting and recommending various treatment and resources that are available, and obviously continuing to arrange follow-up. This was just some of the examples of with that case scenario. We were wanting to highlight some of the psychosocial interventions in terms of self-help workbooks, some of the programming we mentioned, and the psychological interventions. We heard from Carly in terms of what they offer, but there's also some other private practice and CMHA that provides support, and the Ontario Structured Psychotherapy. And then the medication will leave to you as the experts, but also recognize there is a really great amount of detail in the new CanMat guidelines. So I'm going to maybe stop sharing, or I think I want to show you where the care pathway is before we end. So just 1 second, I will see if I can stop sharing for 1 moment and pull it up.
That's also shared in the chat, Tracy.
Okay.
So if anyone
great.
wants to click on there, they can as well.
Okay. Like I mentioned, I'm feel like I'm really familiar with Teams, but not as familiar with Zoom. So I'm sorry for the little delay here. Can people see my screen now? Yeah? Okay, I see some nods, wonderful. So I just want to highlight where you can find the care pathway. So it's on the North Bay Perry Sound District Health Unit's website, and it's under our health professional and partners, and you can find it here, Perinatal Mental Health Care Pathway. So this is a pathway just for providers. And as we mentioned, we know healthcare providers can play a crucial role in trying to identify and supporting these individuals. So you have a little visual here of the actual care pathway, just to grab your attention. And if you click on see the document, then the care pathway will open up. I'll do that in a moment. But then if you keep scrolling down, you'll also see neighboring care pathways. I'm going to click on this. Actually, I have it open. Is that you can also find neighboring. So we know in Parry Sound, sometimes people may be accessing services in Aurelia. So if you look, there'll be this is a neighboring care pathway that has some additional resources that expand a little bit further than Parry Sound. And if you actually click on Parry Sound, we have coordinated with them, but it links back to our care pathway. So that's where that will direct you to. Some of the feedback we got was about, people's comfort in terms of using the screening tools. So if you click here, you'll find each of the screening tools. It'll open for you. It'll score for you. It's a PDF. You can, use it with the client, fill it out, score it, print it off, and use it at your offices or when you're working with families. So those are there for you to use. We also have some other resources at the bottom. So some key messages linking to some of the key references that we've chatted about, some patient handouts. So this was the accompanying CanMet document that they made for individuals pregnant or postpartum. So it's a really thorough resource that's available, and some other patient handouts, the links to the self-help resources that were also listed in the care pathway, and then also some clinical resources. We also are just about to launch having an additional drop down where you can subscribe for updates. So we are encouraging people, if you're interested, to go in and subscribe or share your emails with us today. And so we can give you live updates as well of any new resources that we have come available. Okay, so I think we're almost up our time. Hey, Kathy, I just have I think a couple more things I'd like to share. I don't know if people have a hard stop in terms of
why don't we just pause and see if there's any questions, and then you can
yeah, that'd be great.
If anyone has a question, please feel free to unmute and just ask. I'm not seeing anyone, so if you want to continue on.
Okay. Yes, 1 second then. Thank you for pausing. It's given me a minute to then readjust my slideshow. Okay, can everyone see that? Again, so this is just the QR code to the couple care pathways. Like I mentioned, our neighboring Muskoka care pathway and the Nipissing-Parry Sound, there's a QR code they can also use. So just to wrap up, we know that healthcare providers play a critical role in enhancing perinatal mental health. We encourage you to explore the resources, think about how you can engage with your patients and have a conversation more, and looking at adopting this wraparound approach in terms of working with the families, perinatal families in our community. We hope to influence early identification and interventions to improve patient outcomes and streamline care delivery. Yeah, so I think on this slide I have just highlighting what we've just already kind of went over in terms of where you can access the care pathway, the tools that are available, and like I mentioned already about staying connected. So we maybe we could stay connected as well with Kathy that could share the information. But if you're interested in joining our committee, we meet monthly over the lunch hour. Or if you'd like to be added to our mailing list to get the minutes, that would be great. And as mentioned, we have a desk reference. There's like a little visual there on the bottom corner that is underway, and it'll be double-sided, so that will be released very shortly. And we're also looking at adapting some other patient resources. Some of the ones we shared today are quite extensive, so we're looking at just kind of updating some of the information and going back to some of the research, Christina, at Canador, they had done, looking at increasing awareness, also of the general population. And our group has also, there was a local Nipissing district medicine wheel Indigenous care pathway that we've talked about a desire to update. And so those are some of the things that are kind of up and coming with our group. And just to end with this statement that everyone has a shared responsibility to foster children's potential and build family and community resilience. And we're really pleased to be sharing this Ontario Early Adversity and Resilience Framework. If you haven't had a chance to see it yet, it has a lot of great science and resources in there, and I'd encourage you to take a peek. So any further questions, you can reach me as the chair of the committee, and there's my contact information. And we're just really grateful to have this opportunity to connect with you today. And as we were saying to Kathy earlier, it's been a while since some of us as working with children's services in the community has had an opportunity to connect with the medical community and healthcare providers in our area. So we're hoping we can stay better connected on various different projects. There is a reference list at the end of the presentation and some learning opportunities. There's some online courses you can get credits. The SOGC has a toolkit. There's some other perinatal mental health specific training that's available. And there's some research, a lot of really great research happening. This Move-In project is just launched last week, and it's a province-wide randomized control trial. And the pilot of it was really successful, and so really excited in terms of this digital intervention. And I can also share more information with people about that as well. I think it's hyperlinked in the slides, and we can also share that more widely. So. Yes, that's it for our presentation. So thank you so much. We're going to run out of time, but now I can see we're just on the edge of 1 o'clock. I know everyone has a really busy schedule, so we hope you found this helpful and that we can keep in touch.
Okay. Thank you so much. And I'll open it up in case anyone has any burning questions before we wrap it up totally.
And sorry, I'm just joining back to the chat. So wonderful to see everyone that's here today. Sorry we didn't get a chance to formally meet through that Mentimeter at the beginning. Yes, we're really excited for people to have a peek at all the resources in the care pathway and reach out if you ever have any questions, or if we've missed something, or a link isn't working, please let us know.
Okay, I'm not seeing anyone unmute, and I don't know if you've read right to the bottom, but everybody's thanking you so much for sharing these valuable resources with our team, and thank you for all the excellent work your team has done for the community. It's exciting times ahead for this population group.
I think so too.
Thanks for having us. We appreciate it.
Oh, no worries. Thank you very much for making the time to come and present. And just a reminder, our next rounds in November will be with Dr. John McFadgen. So look for the poster coming your way. And thank you very much, ladies.
Have a great afternoon. Thank you, everyone.
Thanks, Kathy. Take care.